He's a student and she's a teacher, and the two have much more in common than just heading back to school. KHOU Den spends a lot of time on the computer, and he's going to spend even more time now that he's heading to medical school.
I was waking up at night and it was hurting, and that was like one of the cardinal symptoms.
KHOU came to the hand center and Dr. Andrew Lee confirmed KHOU had carpal tunnel syndrome.
Carpal tunnel syndrome is a pinched nerve at the wrist. It causes numbness, tingling, and pain in the hand.
Although it's fairly uncommon for a 23-year-old young man to have carpal tunnel syndrome, KHOU's symptoms were getting worse and making it more difficult for him to do his research.
Because of my timing, I had to start medical school within a month. I figured I might as well do both, and I had a fiance to take care of me for a whole week.
Ava Harrison is also heading back to school. She's been teaching for 22 years and is currently in the Cy-Fair School District working with special needs students.
I would notice sometimes when I woke up that my hand would feel like I'd slept on it wrong.
Like KHOU, Ava was diagnosed with carpal tunnel syndrome and sought the expertise of Dr. Lee at the Hand Center.
For the past 10 years, I've been using endoscopic carpal tunnel release. With this technique, you use only 2 holes, so the scarring is minimal. Therefore, return to regular activity is much faster.
Effective, safe, and fast, according to Ava.
The procedure itself, at least for me, was very, very short, so they had me back in recovery within 15 minutes.
Both KHOU and Ava are now ready to head back to school and won't have any trouble doing their homework.
Whether you're a teacher or a student, to go back to school and pursue their career with better use of their hand. To hear that from my patient, to me, I think it's the ultimate reward.